When a patient comes in initially, our consultation is typically to find out the most we can about them and their life before and how they are proceeding through it now, and then to give them as much information as we can about the procedures going forward. The whole idea is really to build a rapport and a dialogue with the patient so that they can understand, work with you, trust you. They know that they can communicate with you. And that's really the biggest key, is communication.
The first step would be involved in the wearing or utilization of a shrinker, a prosthetic stump shrinker as it's called. That helps manage some of the pain and swelling following the surgery. When the limb is ready to progress to the next phase, then we start off through the casting techniques. Typically that's involved of wrapping the limb with plaster and manually massaging the areas to conform to the bony prominences and the soft tissue areas.
Then there are areas on that device we want to add pressure or take away pressure. So that requires somebody like myself, a prosthetist, to shave the cast and add plaster to certain areas just to make sure that this is going to be a successful fit in the future.
From that point, we'll fabricate what is called a check socket. It's sort of a device, a clear device that they can stand on. We can evaluate the contours, make sure things are fitting appropriately.
We'll stand them, walk them in that test socket. And that test socket ultimately is used as a form of a template for us.
And then once we're both satisfied with the fit of the prosthesis, then the technicians can take it and turn it into the finished product of all the finished components and materials.
Typically, there's a flexible inner liner with an acrylic carbon fiber frame outside of it. So it's very lightweight, very durable. We use a dual socket method so that we have adjustability later. Typically, patients aren't static. They're dynamic. The device that we build is static, so we like to build in a little adjustability later on down the road. We can custom tailor the next version, the more permanent version for them that is ultimately going to meet more of their goals for activities of daily living as well as hobbies and other interests.
If you want to do more athletic things, you want to lift more heavy things, you want to just walk over uneven ground, they will figure out with you the best solution to get you not only comfortable but functional.
Live without limitations. Prosthetic and orthotic solutions. Call now for your free consultation.